Hello, everybody. Welcome to the Clinical Trials Scoop. Today we are with the world famous Chris Sauber and world famous
You're so funny.
Dr. Al. Today we're going to be discussing two pharmaceutical companies that we work in the past. They're similar in some ways, but not quite the same. So we were looking for the hottest pharmaceutical companies right now in the market. And this was on October 13. The two stocks that were more popular back then was Bayer and Biogen. And then the other one that we took a look, it was, one second, I believe it's this one. No.
It's the second to last one. You're talking about the BIB, right?
Yeah, but there is a list of the 5 most, like the hottest stocks in the market. And one of those was Btv, which I found it a little bit interesting because both of them are looking for medications for Alzheimer's. And I found this comparison. This is actually explaining both companies. So Btv Therapeutics is a clinical stage pharmaceutical company that focus on the discovery and development of human therapeutics to fill unmet medical needs. But they've been working for a while in medications for Alzheimer's and also for diabetes. And Biogen is similar in that because they specialize in serious neurological and neurodegenerative disease. And both right now are like hot in the stock market. The difference in price is quite big because BTV is, I believe is right now is
16
the current
cents.
price.
16
Oh,
cents.
wow. Imagine it went even down than it was when I got this. But they've been kind of stable in those prices. So I'm not sure they went really high in August, the price, if we compare that to 60 cents. And then Biogen is 244.
So do you work with any of these pharmaceuticals for research? No. Do you use
We
any other?
did.
Do you? I know we did, Monica. Do you use any of these in your daily practice?
No,
No.
but it's a neurodegenerative disease, so I think I had a couple of clinical trial for neurodegenerative disease. That's I did earlier, but for me to work as prescribing medication for my patient, no. There's neurologist. This is the specialty of neurologist.
Right.
So I started taking a look what was new for diabetes because one of the conditions that both of these companies do research for is also diabetes. And I found out 199 studies. So
Wow.
very
Wow.
interesting. All of them not yet recruiting and recruiting.
So did you kind of scan through all of these?
Yes.
Are
And I found one that is for BTB.
okay. Are any of these a cure or are they all treatments?
I think they are all treatments.
Okay.
Yeah, but this one is Alzheimer's with diabetes, with impaired glucose tolerance. And the name of this study is Elevate. They started in June last year, and the last update was August this year. So I'm thinking that they are more likely behind just because of COVID.
So it's interesting that you bring up that VTV is working both in Alzheimer's and diabetes. Now, I've read some articles in the past in which they call Alzheimer's type 3 diabetes.
Exactly.
Wow.
Mm-hmm.
Wow.
Yeah.
Yeah, me too. I read the same. Mm-hmm.
You're not aware of that, Dr. Al?
No.
Yeah, there's some similarities between diabetes and Alzheimer's. It's been a while since I read anything on it. This was years ago, but there's some reason that obviously that they find their similarities and why they're kind of calling it type 3 diabetes, the Alzheimer's.
Alzheimer.
Yeah.
So look at the name of this study.
Where's the name at the top?
So it's yeah, the study
Study of
of
Alz-
acetylcholine in patients with mild Alzheimer's disease and impaired glucose tolerance.
Yeah. Well, there you go.
So, yeah, and they have another one that is with Alzheimer's and type 2 diabetes, with type 2 diabetes.
The same company?
Yeah. They have I mean, a lot of studies. I think they are using the same compound, but I'm not sure. Yeah, one of this. Yeah, this is it, because we work in the past with this. So this is phase 2 and phase 3 for acetylcholine.
Yeah, very nice.
Yeah.
Can you go down a little bit? Let's see what's the goal of the study, what they want to do.
Yeah.
Here.
Here.
Primary objective. It's not cognitive.
So they're not trying to control diabetes any better. It's just a matter of improving cognition scores.
Yeah. Could be if you control the diabetes, you get better cognition scores.
Yeah.
That's the main thing. With this medication, which you can do both, improve cognition and diabetes.
Yep.
Blood sugar. Interesting.
Yeah. And so I'm thinking that this study is more likely recruiting sites. They wanted to.
So,
they are.
I'm curious. Can you go back down to the inclusion and exclusion? Is there anything on A1C?
Eligibility criteria here.
A1C here. Hemoglobin A1C at 6.5 to 9.5.
Yeah, that's fairly well controlled. I mean, anything under 7.
9.5 is no.
Yeah, but anything under 7 is for a diabetic well controlled.
Yes.
9.5 not so well.
At all.
So, all right, interesting. So they're allowing a wide range of patients with diabetes, and it's not just well controlled. It's kind of the gamut there.
Yeah, and it's what I found interesting is in the previous studies, one of the exclusions was if the patient had diabetes.
Sure.
If I don't, I mean, if I recall well, do you remember, Chris, or not really?
This was for Alzheimer's?
Yeah.
Was it for their previous study that our sites worked on?
Yeah.
Yeah, I recall. It rings a bell, but I don't remember specifics.
Yeah, I'm almost positive that was one of the exclusions.
Yeah.
Because I remember, I will say like probably 60% of our patients that were diagnosed with Alzheimer's had diabetes of some type. So this is the information, this study. I'm almost positive they are looking for sites right now because they started only just last year. And they are trying to recruit 300 patients. Here you go, 300 patients, and they're still recruiting. So maybe we should apply for this study.
Yeah, they're a ways off from completion to 2023.
Yeah.
Wow.
Exactly. So this is a good study. It looks like a good study. Then we have, I was checking also on the Biogen pipeline. They have many studies going on right now. And so they have for Alzheimer's disease. Let me see this one right here. They have, let me see. So they have this one for Alzheimer's disease is phase 3. Phase 3, we can maybe take a look and see this one. I couldn't find this one on the clinicaltrials.gov, but this is a current study that they have. And they also have another one, see? So I think those are different compounds. This is one, and then this is the other study for Alzheimer's. Oh, they have here the information. And this one is phase 2. This one was phase 2. I think that's about it with Biogen. Oh no, look, they have another one here. But this is phase 1.
Yeah, they have some studies for Alzheimer's, that's for sure.
Wow, so, yeah, another one.
So I'm curious, Dr. Al. So I know in the past couple of 2-3 weeks we've been talking a lot about the GI studies. Well, GI studies too, in terms of how a lot of diseases are related or possibly related to the GI tract. Do you see any reason why diabetes would be related to Alzheimer's? I mean, that's not the GI tract, but yeah.
Could be.
But I know it's not your specialty, but do you see how would it be the sugar doing something to the brain, something like that? I mean, what would be the rationale?
Most probably the sugar could be doing something for the blood supply to the brain. Okay, that's what's the origin of all the neurological diseases, and I think it's the blood supply to the brain and what's happened there.
Okay.
So it could be like the blood supply to the brain has interrupted or have different velocity that can affect the brain, because nobody know much about how even Alzheimer develop in the brain for so far. So all this like possible treatment for Alzheimer, but that's why we have too many things, because the exact etiology for the disease itself, it's not clear.
I'm going to slaughter the medical terminology here, but they used to think it was the tangles in the brain. There was, I can't remember what they're called. And they found a medication that removed all those.
Could be. I'm not sure about it, but it could be.
Yeah, they have no idea about Alzheimer's and what causes it.
Exactly. They know it can affect on the memory and in the brain function, but exactly how does it do that? So far, they're trying to find it. It's like cancer. They don't know what the etiology. They're trying to find disease, treatment for it. The same thing is for Alzheimer. They don't know what's causing it, and they're trying to find treatment for it.
So, do you think we'll talk a little on your specialty? Do you think the GI tract could have any way cause in cancerous tumors?
Of course, 100%.
100%.
Yeah. I think that the absorption of the material, the way that the body metabolizes it, whatever you eat, can affect in your health and on the development of cancer, for sure.
You think that's
yeah, and bringing this, I think one time I read that the bowel is the brain of the guts or something like this.
You said that last week.
I did that. Yeah, I read that too.
Yeah, because there is a lot of hormone that can be secreted by the bowels and by the small bowels, and that can affect on the mood of the human being and on how they react for certain kind of medication. So I think that's what could be the reason.
So let me get this straight. Depending on how your bowel behaves, that can affect your mood?
Yeah, of course, 100%.
I mean, I understand.
Because they're going to secrete some kind of amines that can affect your mood, for sure.
I mean, I understand
You
being,
eat chocolate, you feel good.
yeah, oh yeah, and I understand being constipated. You might not be happy about it, but you're.
Depends on who are you.
Absolutely. but
Oh
but
my God.
you're saying it goes a step further than that, right?
Yeah, yeah. I think there is a lot of studies now about the thing that's secreted by the bowels and how does it affect on the mood, how does it affect the body.
Hmm, very interesting.
Yep.
I've never heard that or read that. That's quite interesting. So
I
do,
I find something if I able to recall what I read that I may forward it to you.
oh, that'd be great.
Yeah,
Uh,
yeah, 100%, Scott, Chris.
so hopefully Scott's a good guy too. So so do you think that's the primary cause of tumors? Is the gut?
No, 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 no. But
No.
we don't know exactly what's causing the tumor in general, but it's different mechanism, different stuff that can cause this. So there is nothing one reason by itself can cause this, but the gut itself, I don't think so. But it may contribute to it.
Oh, okay. And
But I'm not sure even about that.
yeah, I mean, I remember reading something a while back. If children eat more than 20 hot dogs a month, they're much higher rate of leukemia or something along those lines.
Everything can happen.
Yeah, everything causes cancer, right?
Everything can cause cancer, and you can associate it with cancer. But is there any definite reason that can say yes, it is the
Hmm.
cause? No.
Right.
But everything, breathing bad air can cause cancer.
Yeah.
There's association. They found it maybe in the United States, but they didn't find it in China.
Yeah.
Okay,
Really?
so yeah,
How's that? The air quality in China is much worse.
Yeah,
I know, but
exactly.
you know, it could be.
Interesting. Yeah,
Yeah,
interesting.
but because the Chinese people food is different from here.
True.
And
True.
also,
See,
and also, probably the body develops more. Their system, the immune system, develop more defense towards that part
Hmm.
because they are breathing all the time this terrible air.
But I'm sure Dr. Al's got a point there. I mean, if you eat a more vegetable based and lean protein diet, lean fat diet, as the Chinese I think do, you're probably less susceptible to cancer.
Develop
I know,
cancer.
but see, it depends on the country and what their habits. Chinese they uh,
They don't eat
may
too much
not get
McDonald's.
the lung cancer as many as other country who smokes a lot or have
Yeah.
much worse, better quality, but they get like the liver cancer because they have a lot of hepatitis.
Well.
Okay. The Japanese get a lot of esophageal and gastric cancer because of they eat a lot of dried food. You
Hmm,
see, so each country have its own characteristic about their food, their weather, their habits that can prevent them or predispose them for certain type of cancer.
right. Okay. That makes sense. So let's get back to the Alzheimer's, huh, Monica?
Yeah. So actually, the ones that have more predisposition to have cancer are the Latino Americans and also the African Americans. So
Yeah.
I'm guessing it has to do also with the same uh, food and also habits. I think especially food
Is
because
that is that a question to Dr. Al? Well, what's the correlation?
yeah.
What was the question? I'm sorry.
So why do African Americans and Hispanics have higher rates of cancer?
No, I Alzheimer's.
Oh, Alzheimer's. Okay.
So
Sorry.
it's not for me.
And I was reading the other, I mean, when I have done the demographics on many conditions, we have more predisposition to more conditions than any other communities. And I'm thinking is more likely because of the food, because we eat a lot of carbs, or I don't know.
Well,
Doctor, what do you think?
I think that the the percentage of eating a higher fatty food or being overweight or being like this, all that can contribute to the uh, your body metabolism and the different things that can produce and can affect on your uh, mental ability or in your brain. One of them is Alzheimer. We know that fatty food and obesity can contribute to cancer for sure for certain type of cancers, but also it could be contributing to this because if diabetes, let's take it like this. I'm not the great guy for neurology, but if blood sugar can contribute to the Alzheimer, uh, overweight can contribute to uh, pre-diabetic condition. So most probably it is correlating.
Mm.
Mm.
That's correct. Yeah. I mean, and the highest index of diabetes is also the Hispanic community as well as the
So that's
African
why maybe they have
American.
higher percentage of Alzheimer and their type of diet and food.
So do you know anything about? Because I've read that Okinawans are the probably the healthiest people on the planet. Uh, have you read anything on? I'm sure you haven't, but maybe on their rates of Alzheimer's. Do they have lower rates of Alzheimer's?
Maybe because they eat healthy and their
Yeah,
hemoglobin A1C is always in the low side and their blood sugar and their
yeah,
uh, they are not obese or not overweight and they within their normal ideal body weight.
yeah.
So
So a good portion. So the saying as it goes, you are what you eat. That
yeah,
definitely holds some. Oh, definitely holds some water.
100%,
Yeah.
100%. Yep.
So if you want to
I
be,
believe in this thing that you are what you eat because as we were discussing earlier, like whatever you pass through your bowel can affect on your mood and your hormone and in your brain even.
yeah.
And now you're telling you whatever if you eat a lot of sugar or you're overweight, you have metabolic syndrome, then being more having higher tendency to have Alzheimer. There is correlation here. So
Mm-hmm.
100%.
Hmm. So
Uh-huh.
don't so don't eat McDonald's every day.
No.
No.
I don't want McDonald's to come after me. I don't know. Eat healthy. 5 serving of fruit, 5 serving of vegetables a day. That's the what's recommended by American Cancer
Yeah,
Society to
yeah.
be
They
on.
cheat. That's a lot of fruits and vegetables. It used to only
I
be
know,
five
but
total. Now it's
I
10.
know, I know. Fruit. After eating vegetables, you need to eat fruit.
Yeah.
Okay. Yep. You need some small minerals and rare things that you can find it in regular food.
So eat your meal and then eat some fruit after it, huh?
Exactly. And eat healthy meal. Don't eat McDonald's and eat fruit. Ah, I'm doing what I need to do. Hello.
What is considered healthy these days is kind of difficult sometimes with all the, those products or that have so much, process and
Oh, yeah,
and
lots of
even
corn syrup,
vegetables. Yeah.
lots of salt, and everything these days. Yeah. If you don't
Yep.
eat fresh, it's hard to eat healthy.
If you don't eat fresh, it's hard to eat healthy. Fresh and organic.
Hmm.
Yep.
So, do you think there's? Well, let me ask you directly. When you go to a store, I don't know if you shop or if your wife does, who shops, but when you do shop, do you only buy organic? You see vegetables, you see just a regular cucumber and an organic cucumber. Do you buy the organic? And if so,
Yes.
why? Why?
But I think because uh, it is healthier to get the organic than the one that have hormones that depends on the growth of the even the chicken or the meat. It is like a grass grown or chicken organic or like this because of the hormone. The eggs organic because these things can carry the hormones to the body and cause other complications. So that's why.
So the additional hormones is what you're trying to avoid.
Yeah, yeah. It's not for me, even for my family, because I still have my family need to be in the growing period of their life. Is not as the
Hmm.
I think I've been doing it since I started having uh, uh, kids. Since they start like 1 year or less when they're born, I start
Well,
doing everything organic. Yep.
okay. Well, I know I read something else somewhere recently about the reason that people are getting larger in America is because of all the hormones. A big part of it.
Exactly, the excessive hormone that you don't feel it, you don't know about it. That's in these products, even like some traces of it.
Yeah.
And also the mm, the process in the vegetables. I forgot the I have it on the tip of my tongue. The engineering in the food right now, like they just how you call
GMO,
that? The GMOs. Mhm.
hello.
I know. I was trying to say that the GMO products.
Get her,
So
Dr.
that
Al.
also affects because I think that that's kind of recent, and they don't really have much data about it. So they cannot prove yet if the GMOs actually affects the body or not. What do you think about that, doctor?
How long do you know the GMOs around?
Uh, I think probably in the past 10 years.
And do you think they don't know about it or they know it and they're covering it?
More likely.
Okay, so I think they know everything, but it's a marketing, it's something in the market. They need to sell it, People like it and they need to sell it. Even that's why I think the industry in the United States, it is really, uh, it's pro money, not pro people.
That's profit driven.
Yes, 100%. Okay, they care about how much money they can make or like this. Do they care about the health of the people? No. Okay, blood sugar, obesity, everything, every year is increasing. We know all this is bad for the body. All this is bad for the economy. All this is bad but who listens?
Yeah.
Everybody wants to go for profit, wants to make money.
I completely agree with everything you're saying, but I think that's a problem worldwide. I don't think it's just United States, though, is it?
I think in in the less industrialized country, even in some of the industrialized country that like that Scandinavian country and like this, they do not have this kind of direction in they're more health oriented, and they make their government more health oriented and defend their rights for the health.
Mm.
It's not like here, which is the government like letting the health system goes its own way without any consideration of the general population.
Yeah. Well, statistics show that we are a very fat nation. We're second on Earth, right?
Yep. And that shouldn't be happening for the most the leading company in industry. Why?
Hmm.
Why?
Well, I mean, there's a lot of different opinions on that. Some say it's wealth, right? Where everybody has access to food, so they overeat and they
I
eat.
know, but you can push toward directing the people to eat the healthy one and try to prevent or restrict or put more taxation on the unhealthy food. But
Mm.
you don't do it here. The unhealthy food is the cheapest. Everybody can grab it.
Sure. Easiest and quickest and
Yeah,
cheapest.
exactly.
Yeah. You can go to McDonald's and get a hamburger for $1.50.
Why it should be like this?
Yeah.
And
The,
then they give you the option to pay 25 cents extra to make it bigger.
yeah. Do you think this is wise for the people?
No, probably not. I know the portions
Okay.
here are much larger than most other countries. I know when people from other countries come here and you take them out to eat, they look at the plate of food that's brought to them and like, oh my God, that's just huge.
Yeah. So I think that there is something we do not, not we don't, but I think the
Help him,
system
Monica.
does not care about. Help him, Monica. Hello. Yeah.
Oh gosh.
So you were saying, Dr. Al?
Nothing. Let's go. Let's go back to the other stuff.
The Alzheimer's, where I
Uh-huh.
think that's all for today. These two companies, and that both of them are in the list of the hottest stocks in the market. Both of them work towards conditions like Alzheimer's and diabetes. And I mean, I think it's just almost natural that they have the stock market for them are in the top, just because besides all the COVID treatments and vaccines and everything, another pandemic that we have is diabetes. So, and it's worldwide too. So I think these two companies probably, obviously, we're not finance reporters or anything.
This is not financial. This is not financial
Exactly.
advice.
But Monica, one question for this company VTVT. What is
Yes,
in their pipeline?
they have. I'm gonna show you. I actually don't think I have it here, but they have. They just do research on conditions on unmet treatments, like for example, Alzheimer's, diabetes, like it says here, develop human therapeutics to fill unmet medical needs. Let me take a look on BTB.
Yeah, I think they're primarily diabetes and Alzheimer's.
Wow.
Pipeline, yeah. So here it is. So diabetes, dementia with diabetes, cystic fibrosis related diabetes, and type 2 diabetes, fatty acid oxidation disorder, and COPD.
Interesting.
I don't see any Alzheimer's there. Oh, dementia.
The dementia, yeah.
Yeah.
This is the one we participate in, I believe.
Yeah, it is.
Mm-hmm.
Cystic fibrosis. What's that exactly?
It is some kind
It's on the
of
lungs.
genetic deformity that can cause for the secretion in the body, in the lung, in the other organ to be abnormally condensed and can cause a lot of complications such as infection and sterility.
So, and that's horrible. But
Yeah.
but so that makes the organs more dense.
Yes.
Huh.
Well, that's abnormally like secretion. That's yeah.
Interesting.
Cystic fibrosis.
Okay. Interesting.
But
So
I
these are the
think
two
now there is
companies.
one of the companies that they found a treatment for it. They're doing a trial for gene re-engineering to reverse it, as they're doing in sickle cell disease, because it's also a genetic mutation that can cause this.
So how far, this is completely off topic, but how far away are we from being able to wipe out most disease through genetic alteration?
Ooh, very far.
Very far?
Very, very far, because we just started.
Yeah.
There's like a couple of company, like I think it's like 5 or 6 company. They are the one they're doing this now in genetic alteration. But also when you come to the genetic alteration, then you're gonna come for a lot of other issues. Okay, like moral, ethical, it's
Sure.
completely different law, and just the uh what they call it, the Nobel Prize that's this year awarded the one of the genetic engineering, which is called the CRISPR, the Nobel Prize. So imagine we just started in it.
Yeah.
So if they just recognized it, the award, by giving them the Nobel Prize for genetic engineering. So we know
They're gonna get
we're
rid of
not
all.
even close.
They're gonna get rid of all people with no hair. You and I are gonna have a problem, Dr. Al.
I don't think there'll be more. The main concern for them is the hair or no hair. I think there's more important issues that they need to.
No, I know. I'm just making a joke, but yeah, I ethically, yes,
I'm just giving you a
absolutely.
hard time.
Are they going to get rid of short people and only allow tall people, or the reverse, or
I but all these issues like also goes within ethical like
right,
issues like
right.
yeah, and what's the side effect of it? Okay,
Hmm.
we know now you're giving COVID, which is like also like a messenger RNA that can cause a lot of side effect. So
Hmm.
we just started and we don't know much about it, so it will be very difficult to predict what's going to happen and how it's going to happen, and so we still way behind.
Aren't they doing something with that though, with the conception, so where you can kind of genetically alter your child? Aren't they working on something with that as well?
I think they can control the sex of the fetus.
Right, right.
Okay, from yeah, they can do that, and they have no problem doing that. But also, it is this is completely because the sex chromosome are much less, much better to control than other genes in the body.
Okay. Easier to control
Easier to control, or
than say remove. Yeah, you have a
you
diabetes.
have this piece of DNA that it is on the small r on the small arm of the chromosome 9. You're gonna
Right,
switch it with so you
right.
need to target it with a special messenger RNA to go to refix it, and this is not only in one cell, it's mostly in all the
Okay.
other cells, so you may need to target the stem cell too, so it will produce normal cells.
And we're nowhere near that yet.
I'm not aware about that, even I'm not the but I'm not aware about that.
Okay.
Yep.
All right. Interesting.
Very interesting if you go in that route of of
Yeah.
investigation.
Yeah. Yeah.
Yeah, but I cannot imagine the clinical trials for that.
Yeah.
I think there is the clinical trial for sickle cell is up and running now, and I think there's one of the patients they published the data about that she used to get blood transfusion because of the hemolysis that happened with her because of sickle, and she's been now a year without any blood transfusion.
Hmm. Wow.
Okay,
Wow.
yeah. But I did not review the actual. It's only one case, and I would not take it as the actual source for information or results.
Hmm. All right.
Yeah, we have to probably wait more years to see more data about it.
All
In
right.
my opinion, if the gene editing revolution gonna come back out, gonna do the computer revolution happened, because it's completely different era of medicine gonna be. That's a patient comes to you, have diabetes, take this injection every month for the next 6 months, you're cured from diabetes because you're reversing the gene that can cause diabetes. If you have hypertension, if you have heart attack, okay, you have high cholesterol, take this injection, and maybe they start with injection as happen, and after that they start with the pills. Take the pills for a whole month, and you'll be okay.
Hmm.
So
It'll be
there will be mainly engineering doctors, not a regular doctors, physician. So
then
it's going to be a big revolution in the medicine
when
in
we get
that
to that
regard.
when we get to that point, then we have other problems to overcome because there'll be a explosion in population. I would think when you can cure all disease, you're gonna have a lot more people around for a much longer time.
But remember, you still have people, and the people can make wars.
Yeah, this is true. This is very true.
Hello.
This is very true.
And also the epidemic and the endemic that can happen, and that can cause a lot of like corona now. Engineering we're not gonna control it.
No, of course not.
There is other stuff that can control us. Not.
Yeah. Can't solve all problems, huh?
Yep.
All right. So, did you have anything else to add, Miss Monica?
No, I think that's it for today.
Is that it for today?
Very
Yeah. Very interesting chat.
Yes, it was. Thank you, Dr. Al. Thank you, Monica.
Thank you, Chris. Thank you,
Thank
Monica.
you.
And
Thank you,
we'll
both of
talk
you.
later, guys. Thank you.
All right.
All right. Thank you.
We'll see you tomorrow, Dan
Okay.
and I. See you tomorrow, Dr. Al.
I'll
right.
see you, Chris.
All
Bye.
right. Bye-bye.
Bye.